Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Diana Londoño. She is a urologist and a health coach. And her Kevin MD article is From Healers to Influencers, How Fear Took Over Healthcare Advice. Diana, welcome back to the show.
Kevin, thank you so much for having me again. It's always a pleasure. I'm just so grateful to be here. Thank you.
All right. So, your latest article, From Healers to Influencers, tell us what it's about.
Well, it's really looking at our role as physicians. And I think our role truly is to be a healer and a teacher. And it doesn't matter if we're inside the exam room or we're outside the exam room, whether we're giving a presentation or now we're in social media, because it's a great tool to, again, do those things. But I think we have sort of lost a little bit or blurred the lines of truly becoming a healer or teacher. And I see so many influencers, whether you have 10 people because they're still an influencer or a million followers, where we're leading and telling people and patients and anybody about things, but we're doing the messaging with a fear-based premise. So instead of teaching or telling people how to do things or what to do, we're doing it with like, I'm Dr. So-and-so, and you should never touch this, you should never eat this, you should never put this on your face. And those messages are fear inducing, which go against healing and then go against, being in a calm state, which we're supposed to, try to share and do for others. So it's time to step back and really look at like, how are we saying the message that we want to convey?
So, I love the fact that you brought up that doctors at their core, they're teachers, right? And I'm sure that you've heard many, many times the word doctor itself comes from the Latin to teach, right? So I think the fact that we have all these platforms, these social media platforms, it's a double-edged sword, right? Because it gives physicians the platforms that they never used to have to really share information and spread that influence. But like you said, we have to yield these tools, these powerful tools, in a responsible way. So you said that a lot of these influencers are spreading health information in a fear-based manner. You gave some examples, but what exactly were you talking about? Is it really just don't a lot of negativity, don't do this, don't try these medications, don't be careful about this? What are some examples that you're seeing from this?
Yeah, I mean, that's the language we are seeing. And, sort of like the lack what we don't have, which is the same messaging that marketing does, or, politicians, they want to try to say, what's wrong? What don't you have? What do you need? Which is different than a loving premise of like, this is what, we should do, just say things, in a different way. And why that matters is because, these 90-second sound bites, you hear them, but there's no context. Like there's no follow-up as you would when you're in an exam room, where maybe you can say the same thing, but then you follow it up with more information and more understanding and more conversation. So when you hear this, and even myself as a physician, not even a lay person, I hear these messages. I'm like, oh, I'm not going to touch that aluminum, or
Mhm.
I'm not going to microwave my food because, or use the spatula that's plastic because now I'm going to get cancer and this and that. So even though I may know the nuances or, science behind it or all that, it still sort of stays in my psyche. And then I'm like, every time I touch this like spatula, I get a little afraid. So why that matters is we are constantly sort of running in the background, this like fear, and then we're like in a fight or flight, cortisol state, and like that doesn't help anybody. So we're more reactive, we're like get a little angrier, we're on edge. So again, it's sort of like understand like we can say things, but how are we saying it? And just because everybody else is doing it in social media, we also have to again remember we are teachers, we're healers, and really everything we do should come from compassion, from love, and I think we are sort of getting a little bit lost in the shuffle because, we want to be like everybody else. We want to be popular. We want shares, likes, tweets, all that. So, just maybe having a little bit of reflection of how can we do our role in and outside the exam room.
Now, are you seeing any specific medical fields where this is more prevalent, or specific social media platforms where you're seeing this more often?
Yeah, I think, definitely like the shorter video ones where it's like TikTok or Instagram, because you have like these, 90-second or less, 30-second attention span. Where other platforms, perhaps, let's say LinkedIn or others, where you have more space to write things and have a bigger discussion, is a little bit different. But in like the video quick platforms or even the retweeting world, sometimes we even, retweet things that, are also not, accurate, but we just do it because somebody else did and we sort of incite the fear. So I think in those platforms, I see it more. I think for specialties, I see it everywhere. I mean, it could be dermatology, it could be functional medicine, it could be emergency physicians. I mean, I see it, all over. And there's also a great way to do that. And I can think of, platforms where people like, my specialty, Dr. Rachel Rubin, things she talks about really affect people and women. And, there's a risk of sepsis and dying from the things that we're not doing or doing for a woman to help them, but we don't do in a fear-based manner. So there's many great examples of people doing it beautifully and people that maybe haven't thought about it perhaps, and it's just again bringing awareness. Can we step back a little bit? Can we just, continue our platforms, continue educating, continue getting followers and patients and people for your masterclass, but in a different manner?
So I think you hit the nail on the head in terms of why this is happening. A lot of these influencers, of course, they want to get more followers and clicks and likes. And in these short form platforms like TikTok and Instagram Reels, you only have a limited time to do so. And it's been shown on studies that fear-based messaging tends to get shared more often and clicked more often.
Absolutely. I mean, you see that. I mean, I see their Instagram account, and then I see the one that was like, "Do not go here, do not touch it," and it's like one, million, likes, and then the other one is a lot less. So of course we're human. Of course we want that dopamine hit. We want to see those likes and shares, and also, yeah, we're growing, and then we can rationalize, perhaps say, "Okay, well, I'm reaching more people." But again, at the cost of what? And again, you could do that, but do not then preface with, I am Dr. So-and-so, and this is my message. You can influence all you like, but when you start your message or your reel with, I'm Dr. So-and-so, just remember we have a Hippocratic oath of doing no harm. And we are, again, teachers and we are healers. So just let's respect our true identity that we have.
In your article, you give a powerful analogy telling a child, don't run or you're going to fall versus please walk slower, right? So, not just with social media, but just in the exam room, when we're trying to influence our patients, we're trying to convince our patients, just talk more about the psychological impact of negative versus positive framing in health communication.
Absolutely. Whatever we put our attention to is where our mind, our energy, and everything happens and manifests. So, it's just like if you have an idea of making an iPhone, whatever your idea is and what you say is going to become that iPhone. So, if we tell our children, again, don't run so fast, you're going to fall. Guess what's going to happen? They're going to fall and they're going to be like, see, I told you.
Mm-hmm.
But it's like, well, self-fulfilling prophecy. Instead, why don't we tell children what to do or how to do it or what to eat instead of saying, don't eat the Doritos? It's like, oh, here is this. Let's have this instead. So again, patients, kids, our spouse, it doesn't matter who we're speaking to. Let's reframe how we say our words because words are really, really powerful. And so it's just understanding the power of words. And it's the same message if you think about it. But,
Hmm.
again, what do we want? If we say what we don't want, we're going to get all of that. If we say what we do want, we're also going to get all of that. So whether it's our goals, our dreams, instead of telling me all the things you don't want, tell me what you do want so we can start working towards that. So again, whether this is coaching your children, it doesn't matter. It's the same principle. And it's a huge shift and it's a very powerful one.
Yeah, I agree. I think that if we want to shift behavior in our patients, sometimes not doing it from a fear-based approach can be more effective. Now, I want to ask you about paths forward, both from the influencer physician standpoint and from the patient standpoint. So we'll start from the patient standpoint first. So if patients are listening to this and they're scrolling through various social media platforms, just give us a guide in terms of how they could critically evaluate the health information that they're reading on these social media platforms.
Well, I think that is the nuance and the difficulty. I mean, to have discernment, even as a patient or a physician ourselves, like as a colleague, it is really challenging, especially because then we're trusting the name. We're trusting that MD is there.
Mhm.
And then we're like, oh, well, they said that. So definitely I'm not going to do that. So it gets so confusing. And I do have compassion for patients and colleagues alike because, maybe a dermatologist is saying something and I don't know. I'm not a dermatologist. So I'm trusting that what they're telling me is what's really going to be helpful. But also, again, remember there's, people are affiliates, people have monetary incentive to push this product or the other, which may not be disclosed. So understand like, why are you recommending this product that maybe you even haven't tried, but you were paid for it very handsomely. And there's nothing wrong with being paid for your expertise. But it has to be transparent and disclose, what is behind your recommendation. So I do have again, a lot of compassion, and it's a difficult place as a patient to read and say, okay, is this what I should follow? Is this the right stuff? Because then this other person saying something else. What I think could be helpful is, okay, if you see something, then bring that to your physician that you trust and you have a
Mhm.
relationship with and say, okay, I saw this. Like, what do you think? So I think it can open communication and it can make the patient informed. But again, always with a conversation, with follow up, with trust that is your physician.
So, as a urologist, do you find yourself talking to patients about what they're finding on, say, TikTok or Instagram Reels from a urological standpoint? If they saw some urologic piece of advice and they come and discuss it with you in the exam room, how does that conversation go?
Yeah, I mean, well, this is very important because I mean, sexual things, which is what we do in urology, I mean, that is clickbait. That is going to be push and pass and false beliefs, and especially to pornography, right? So the damage of pornography is so, so important as a urologist. And 30% of all internet traffic goes to pornography. That is
Mm.
huge. There's 56.2 billion monthly visitors to Pornhub, the biggest hub of pornography. So how is that influencing my patients of like what normal is, what intimacy means, and then the like really serious effects of like porn-induced erectile dysfunction that is real, that happens to like young men and older men because they get addicted, to this because again, dopamine is getting hijacked. So then they come with shame and guilt and difficulty saying what's happening. And the answer is not to give a 23-year-old Viagra. The answer is to be compassionate, have an open communication, ask these open-ended questions like how many times a day or how many hours are you watching porn? Because it's not saying yes or no. It is saying like, okay, give me the answer, but not at the beginning, after you establish some rapport. And, of course, go through a physical exam and, labs if it's needed, all that. But we need to establish that trust. We need to look at people in the eyes and be compassionate and then have a conversation. But of course, when my patients come in seeing pornography and seeing all these things that I can give false expectations of what's normal, then it is going to be normal to have this guilt and shame and all these emotions that are truly going to impact them, including anxiety, depression, and suicide. So, this is really, really important, especially in like things that are sexual, because again, there's so much out there. 30% of people are going to these sites for education, for curiosity, for it just fell in their lap and now they're stuck with this addiction. So this is, critical.
Now, how about from the physician standpoint? You have a platform, I have a platform. There are a lot of physicians who have these platforms. How do they balance fear-based messaging with something more constructive, knowing that sometimes fear-based messaging is needed to grow their platforms? How can they balance those two different forms of messaging?
Yeah, at the end of the day, it's like, how do you sleep at night? What is true to you? What feels right to you? I cannot tell you how to choose to grow your platform. You can slowly do it organically, or you can do it fear-based, or obviously you can hire people or, buy followers. You can do it in many, many ways. And it's just up to you and the up there, your own personal sort of belief system and your personal ethics of like how you want to do it. And again, it's not right or wrong. It's just how you want to do it. And again, I'm just trying to bring some awareness, some consciousness. Maybe you do sprinkle it here and there, and like you're not the devil for doing that either. But just do you always want to have that? Or do you want to, like you say, balance? I mean, I think life is a balance. Sometimes you may need that fear one, or maybe it's kind of funny and there's a little fear in it, but it's real and it's true and it does get attention. So again, we have to be real. It's not like we're purists, but let's bring some balance.
We're talking to Diana Londonio. She's a urologist and health coach. Today's Kevin MD article is From Healers to Influencers, How Fear Took Over Healthcare Advice. Diana, as always, will end with some take home messages they want to leave with the Kevin MD audience.
Lead with love, lead with love, and lead with love. That's the most important thing we can think about.
Diana, as always, thank you so much for sharing your perspective and insight. And thanks again for coming back on the show.
Thank you, Kevin. Thank you. Thank you.